This road was to lead us to the home of a boy we last met 2 years ago. We found Kabila struggling with nodding syndrome in January 2012 and watched as he improved in May the same year. Our hopes were high as we retraced our journey. Finally, we came to a stop in the compound of his father, Agostino Chiti. A family of about 30 people, most of them children, live here, but it's almost devoid of all life. The boy of interest is nowhere in sight, so is his father, and we call out again. It is then that from all corners they start coming out, but without the person of interest, Kabila, who should now be 14 or 15 years old. This boy in a yellow t-shirt responded to our queries with the phrase, Kabila pay, twice. His brother Odongo Joffre interpreted it for me to mean Kabila was no more.
Kabila died?
Yes.
Kabila?
Kabila is dead.
Are you serious?
Yes, I'm serious.
Kabila? Small. I came here last time. You remember me?
Yes, I remember you.
I interviewed Kabila. Kabila danced for us here when he had mangoes in his pocket. He danced. We played the music for him. He's dead?
Kabila is dead. Eh?
Still in disbelief, we asked to see Kabila's grave. It bore no markstone, just 2 sticks at either side of the soil-mounded grave. Kabila was one of 25 children brought from Kitgum to Kampala in Mulago by woman MP Beatrice Anywa to show Ugandans that the syndrome was ravaging the children in the north. He got adequate care then as well. So why is a boy who was doing better fighting nodding syndrome in this grave?
He nodded until he got exhausted.
Down like that, like this, like that, like this. And that, damn.
After I peaked, the frequency of nodding became so much until he died.
It was the 10th day of September 2013. We were 8 months late. In May 2012, Kabila was a picture of perfect health. Around these trees, he danced with mangoes in his pockets. So we thought all was better because we had seen him in January the same year, and it was worse, but he had improved in 4 months' time. So it is unfortunate to hear that he passed on. He's the third in this family to die because of nodding syndrome. His sister was one of the first victims of nodding syndrome in 2009. Joyce Labo fell into this family war after getting a seizure, symptomatic of almost anyone with the syndrome. In March this year, Kabila's older brother Michael Kidega also got seizures.
Fall in the water.
Sorry for your loss. Was he taking his medicine?
He was taking his medicine.
In fact, Joffre says that Kabila had just collected his month's drug supply from Okidi Health Center 3 the day he died. They're not so far from the facility, and the bonus is that their aunt works there too. Accessibility to the drugs recommended by the Ministry of Health, which only help to manage symptoms of the disease, like seizures, is not an issue. More than 10 other family members, not older than 16, have nodding syndrome. However, there's no well to worry about anymore.
When did you get the boa hole?
Yeah, they got the LWF Lutheran.
Nowadays it's better for you to get water?
Yes.
You no longer go to the well?
They're not going there because all the students, they have a disease. If they go there, they fall in the water.
Most were met in 2012, but their siblings' graves, visible in the compound every day, bring no comfort to living. The parents are resigned to the fact that one by one their children will end up here too, while what is killing them continues to baffle scientists. Florence Naluyimba, NTV Nyokidi Village, Kitgum District. It is a chance meeting when we run into Michael, a resident of Padea district, who was our contact the last time we were here. A fast exchange of pleasantries, and we hit the narrow road, almost consumed by grass, to find Adonga. Remember him? Knowing now that Adonga is at his uncle's home ignites a bit of hope. When we met him earlier, he was living in this house with his brother and father, David Olanya, who spent weeks away from home. Whenever he made those rare appearances, he was always drunk.
He still drinks too much, like in the past when you last came here. He gives nothing to Adonga.
Adonga's mother has since made off with another man to Kitgum. On this trip, we are lucky to find the father. He looks like a man who has been rid of a burden. His two boys, because he has his own to carry. At the sound of many voices in his home, the 20-year-old Adonga emerges.
How are you?
He still has the same gait, with a hunch, and still drools.
But does Adonga have medicine now?
Have nothing to do with Adonga. No one can choose to go to Kitgum Hospital to get a medicine. The government can assist us with drugs only, but the place where we get the drugs is far from here.
Meanwhile, the health of Adonga's cousin has improved. Her mother watches her all the time. It's been long since she fell into a fire. The man who was a constant threat to her since he attempted to defile her no longer lives in the area. From Adonga's home, we pay Marvin Opoka, another sufferer of nodding syndrome, a visit. He lives in Lagol UH village, not so far from Adonga. Such is the shock at the glimpse we have of Marvin from afar, inside a dilapidated hut, which has been his home since he started showing signs of nodding syndrome at the age of 5. We are yet to see worse. Marvin spends most of his days and nights naked. We insist that his mother dresses him up. And out comes the same trouser he has always worn. It is befitting of a 5-year-old. He's 18 years old, by the way.
He has gotten worse, I must say. He has deteriorated further.
His mother has never given him any medication or sought care, and it seems she never will.
Oh my God. Oh my God. Sorry, sweetheart. He was going to eat soap. Did you see that? The boy was going to eat soap.
It is clear that he's undernourished and makes a second attempt to reach for soap to eat. I immediately demand food from the mother, but the fireplace is cold, indicative that no meal was prepared for the day.
That child had already lost everything. Whether protein, carbohydrate, fats, what you see, the muscles there are no more. So he's reaching to get those. Anything edible.
It is approaching 5 p.m. The best she can do is get him leftover lajai, a thick pulp of peas and simsim. Soon, his mother takes him to his feeding spot in this room the two share. Getting the cold food down is not an easy task. Marvin's mother is completely worn out. She lost her husband earlier this year and is now looking after a son who could soon die.
That calls for not only this thing left for the government to handle. We, the local people, we, the parents, are supposed to also handle this patient. I believe this child is just, somebody, you are a curse to the community, to my life. You get it? You are a curse to my life. I won't, even if you die now, I will not shed a spot of tear.
On our way back, we find Adonga. He was collecting mangoes, his main dish. Yes, at 22, he's a man who needs to fend for himself. His father looks on, and we wait for Adonga to make it home. Whatever the future holds for Adonga, maybe the scientists will tell us. However, they continue researching on this debilitating nodding syndrome, which has baffled them over the years. For now, though, Adonga continues to live the same way he has been living since we last met him in 2012. He's kind of stuck in a dark place. Florence, Naluyimba, NTV Nobolokome Village, Padea District. Tucked away further north in Acholi region is Lamu district. Carved out of Kitgum district in 2009, it has a population of over 178,000 people. In 2012, about 500 children in the district started showing peculiar signs and symptoms of what was later diagnosed as nodding syndrome.
We found that out of these 548 people affected, 351 were actually nodding syndrome cases.
The LC5 chairman, Matthew Akia Ochen, who also chairs the district task force on nodding syndrome, says 197 were found to be epileptic.
From the time government of Uganda came in through the Ministry of Health to support this program, we have been able to receive a total of 158 million shillings, 35,000.
This has been used in setting up the district task force, training medical staff, as well as setting up outreach centers.
Out of the 9 sub-counties and 2 town councils, the most affected sub-counties are Palabegem, Palabekal, Palabekogili.
All sub-counties near River Achua and other rivers known to harbor the black fly, which is believed to be one of the many suspected causes of nodding syndrome. We visited Abam village in one of the 3 most affected sub-counties, which is 39 kilometers away from the nearest health center.
As I talk now, some of them have died. Others are now improving. Others are not yet improving.
The district established 12 outreach sites where the medical team goes regularly for assessment and referral where necessary.
There's no single health facility?
No.
I know it is really needed, but at the moment, what are we doing to cover that gap? We cover it through integrated outreaches.
And go and carry out immunization there, nutritional assessment, antenatal care, then postnatal and testing of blood. Then we also bring in the giving of their refill.
But when the refills delay,
sometimes they force the parents to move up to the health center, that is part of the Game Sub-County, to get the drugs for the patients.
The unmonitored children then wander off, some to their deaths.
Here we have one case in this parish, in another parish, that's Game Parish. Also, one patient died in the same manner.
Their bodies were found in the bushes. Patrick Olal, the LC3 chairman of the most affected sub-county, says that some parents no longer tend to their gardens, yet most are impoverished. The free food supply has become irregular.
Very, very irregular. But our idea was that we need to have a sustainable system in place. So that would mean providing them with seedlings, giving them probably obstruction, so that they're able to plow, to cultivate their own foodstuff instead of relying on food handout.
The district authorities report progress with no new registered case since March 2013. No one represents this success like this 3-year-old. She started showing signs of the syndrome when she was just 1.5 years old. Lucky enough, the interventions came during that time. So she's now faring better. Same applies to these people here. They are adhering to their medicines, which is something that is keeping them in shape.
More than half of them have managed to go back to school.
But of course, there are a few others who are still having some challenges. But we also appeal to the community to give all the support, the care.
Akia says that psychiatric officers in the district are expected to go to the schools to make further assessment.
Some of them are slow learners because of the mental retardation. And that would call for establishment of rehabilitation center and special needs education to be provided to such category of people.
For those children who are not going to show signs of recovery permanently, we should rehabilitate them and provide them an alternative life.
Overall, Lamu has emerged the best district in dealing with nodding syndrome.
The commitment of the leadership, the commitment of the technical staff, the health staff, and also the compliance by the community.
But questions loom.
What is causing nodding syndrome?
How long is the treatment going to take? Because we know this is managed just like epilepsy is managed.
It is very strange. Very strange.
The people in Lamu are not yet at home in their minds about a syndrome that just won't go away. Florence, NTV Lamu District. A hand shakes. It shakes in immeasurable pain. It is the only part of his body that can express what and how he feels. Tears flow freely, and sometimes he closes his eyes to stop the pain. But it's inescapable, so the hand continues shielding him as the health worker dresses his wounds. The 16-year-old fell into a fire unknowingly. No one was around to get him out of the cooking area. By the time the seizures symptomatic of nodding syndrome stopped, the damage had been done. Now, he lies in one of the designated centers for treating nodding syndrome in Padea, Atanga Health Center 3. He needs to be referred to a major hospital, but there is no vehicle at the moment to help. He's the only one at the ward with nodding syndrome. Others just come to pick their drugs, meant to stop episodes of seizure. A few miles away from the district in Gulu lies an exemplary treatment center, more of a rehabilitation center, that treats the few patients here. An NGO called Hope for Humans ran the center. A neurologist, Dr. Susan Gazda, co-founded it and hopes to expand to the other affected districts with the help of donations. At another designated health center, Palabek Kal in Lamu district, we find no patient.
They come monthly, after every 1 month. When they come, we carry out assessment, like the nutritional assessment, checking the mark, height, and weight.
Those found malnourished are always admitted here for at least 2 weeks, till they feel in good health to return home.
They are just being given this plumprinat. When there is famine, when people have not yet harvested, their weight go down and they fall frequently.
She says those younger than 7 mostly come with their parents at the health center. The older ones go it alone. The danger, however, is in such rivers. A seizure could see them drown.
We give them sodium valproate according to the kilogram body weight. We also give them the warming tablets like albendazole. We give them vitamin A to protect the eye because majority have sight defect. We also give them B complex. Sometimes we also give them folic acid because of fear of anemia.
Palabekal Health Center handles about 100 patients from 4 parishes every month. The district alone has 351 registered patients. The Minister for Health says about 3,000 people afflicted have been treated, some with admissions at the treatment centers.
The total number of cases that required admission from the 7 treatment centers was 321, and throughout this period, 11 deaths were registered.
Overall, since nodding syndrome was reported, over 200 people, mostly children, have died. At night in Kitgum, we check on how the patients get by at Kitgum Government Hospital. We find a 3-month-old baby whom the doctor in charge tells us was a result of rape. Her mother, now 16, is a nodding syndrome patient at the hospital. Her stepfather took advantage of her. The mother of the 16-year-old is at hand to help, but she too is handcuffed.
You see, the baby doesn't have even clothing. Breast milk is, the mother has been traumatized now. She developed TB. We have started on anti-TB. but she's faring well. Before starting that, the whole body was swollen.
She deals with all this alongside nodding syndrome. Dr. Geoffrey Akena, a general physician at the hospital, who is also the chairman of the task force on nodding syndrome in the district, says they've learned to categorize the patients.
He is having epilepsy, but we are suspecting co-infection with nodding. There are about 3 categories: epilepsy, nodding syndrome, then nodding syndrome plus. Plus means both, both the nodding syndrome plus the epilepsy.
He says management of all 3 is similar. He takes us to meet a 16-year-old who has nodding plus. He turns out to be the boy we met at Atanga Treatment Center a day earlier.
I think they don't have functioning theater, so they brought them here. So we are going to clean this all. It's called something called dyslaughing.
The 16-year-old was diagnosed with the syndrome a year ago. He quit school when he was in senior 2. Not far from him lies a 15-year-old girl, also with burns. Her parents did not know she had any problem until they found her struck down in a fire. She will be handled as an epileptic until signs of nodding manifest, including the one from which the name was got, the nodding of the head. Another one lies here too with burns. These seem to be keeping the treatment centers a lot busier. What all centers battle with are the symptoms of the syndrome.
We tackle malnutrition, we tackle conversion, we tackle fever, we tackle maybe cough, something like that.
Most parents have been deemed negligent.
Because these children are getting burned, these children are getting raped, these children are getting molested.
To try to decongest Kitgum Referral Hospital, other sub-treatment centers have been created. These are backed up by outreaches.
We have received a communication from the Permanent Secretary, Ministry of Health, which showed that in the district of Kitgum there is some bit of poor management of nodding syndrome cases, which we are trying to address.
Dr. Akena, however, says more health professionals are still needed. For now, still not all who need help are reached. 22-year-old Adonga and 18-year-old Marvin Opoka in Padea have never set eyes on asymptomatic medication. Florence Naluyimba, NTV Northern Uganda. In 2012, an American director of the Division of Global Disease Detection from the Centers for Disease Control in the US said that nodding syndrome was a condition that needed to be urgently addressed. Dr. Scott Dow made the remarks at the first scientific conference on nodding syndrome in Uganda.
We've been working for several years and we still don't have the answers.
It is now almost 2 years on, but scientists haven't yet made a breakthrough in establishing the cause. However, the CDC team in Uganda has been assessing the people afflicted by the syndrome in the north. In May, a family of 10 from Lamu district was taken to the National Institutes of Health in the U.S. capital, Washington, D.C., to undergo genetic studies. The institute is the world's largest hospital in the field of clinical research. The family hails from a Bam village.
The study wants to know whether there is any genetic correspondence from the parents to the affected children, and why the other children have remained without the nodding syndrome, and why have the grandchildren remained healthy.
The family returned on May 26.
They took a lot of samples, like fluids, like blood, and even brain tissue, and analysis is undergoing.
In an article posted by Dr. Francis Collins, the NIH director, on their website, the 3 teenage patients, ages 18, 17 and 13, underwent extensive medical testing, including detailed MRI imaging of their brains and overnight electroencephalography, which records electrical activity from brainwaves. In addition, all members of the family underwent a range of medical tests.
It is our prayer to God that out of the 10 people, we should get to know what is the problem and the drug itself.
Nodding syndrome has been something that struck the medical profession and the knowledge of medicine in this particular region.
But the most affected is the sufferer, the one carrying the strange mix of diseases, each of which manifests itself differently. Sufferers experience head nodding, especially at the sight of cold food or cold weather. This is accompanied by cognitive impairment, delayed puberty and growth retardation, with most being malnourished and stunted. Investigations are going on in South Sudan and Tanzania, which are the other two countries known to have patients with the syndrome. Some causes have been ruled out, like suspected consumption of red sorghum, consumption of baboon brain, and absence of reported history of measles in South Sudan. Uganda has its fair share of suspicions.
We realize that there is a very big difference between what the community perceives about the disease as compared to the health workers.
Some of them say, I think the ghost. Some of them say, I think some medicines have been put on hair, so it has catch the people of these areas where they're not, because they are like, why is it concentrating in this some of these areas and not in other areas? Yeah, some of them are saying maybe it is the effects of the bombs.
While some people blame the relief food in the region, experts ruled that out in prior investigations. In fact, dozens of hypotheses have been ruled out. However, there have been some suspected causes, like the onchocerciasis infection from the black fly, resident in many rivers surrounding the affected. Another narrowed down has been vitamin B6 deficiency.
That's interesting to us because low vitamin B6 in rare circumstances can be associated with seizures, intractable seizures, very difficult to treat. And so that provides us some hope that if high doses of vitamin B6 are provided, perhaps that will help these children.
Most scientists agree that the syndrome is a form of epilepsy, with the NUDS being caused by a special kind of seizure requiring anti-epileptic drugs. However, researchers haven't yet agreed on the best drug to prescribe to the patients. In Padea district, the parents in this form did their own observations on the drugs and demanded that the hospital change them.
This is what they were using in the past?
Yeah.
So this one was bad?
Yeah.
So this is better?
Yeah.
Okay.
However, every patient reacts differently to a given drug.
We don't yet understand what the underlying cause is, and therefore we can't recommend the best treatment or prevent this disease in the long term.
Nevertheless, preventative measures have been going on in the form of river dosing to reduce the population of the black fly.
River dosing will continue until the black flies can no longer be detected.
At Blue Regional Referral Hospital, research was done on the nodding behavior of one afflicted child for 3 months.
Had acid in their bodies, and we took all that process out of that patient.
Child temporarily stopped nodding, but got back the episodes after the 3 months elapsed. The researcher from Gulu University, who is also a member of the National Task Force on Nodding Syndrome, says more studies are getting done.
What is there in their blood? What is there in their skin? What is there in all the organs?
Dr. Scott from CDC also has what he calls an interesting theory.
Autoimmune disease. So some kinds of arthritis are caused by the immune system of the body attacking itself. And there are examples when those antibodies attack the brain and cause unusual brain syndrome.
It's a good finding, and we are happy that something has come. But it leaves many questions to be answered. How does it cause the problem?
One thought that we have, which we're interested in following up, is whether antibodies against perhaps onchocerca might be attacking the brain and causing the nodding syndrome.
Some members of the community continue to witness weird occurrences every day amongst the afflicted.
When the hand moves with cheeks around, the child just pick and grab the cheeks and start eating like that.
I think it's becoming epidemic.
The National Institutes of Health considers nodding syndrome a global threat. For now, though, the ongoing genetic study in Washington is what most are looking up to. Hopefully, the Ugandan child and the adult suffering from nodding syndrome will benefit from this in a future so near. Florence, Naluyimba, NTV.